An elderly, debilitated male patient is lying flat on the bed. On examination, the lower limbs shows the wasting of the muscles with prominent fasciculations. The muscle tone is increased and muscle power is diminished to grade 3 by 5 in both lower limbs. The knee and ankle reflexes are exaggerated with presence of the bilateral ankle clonus and extensor plantar responses on both sides. To check the coordination is not possible due to affected marked muscle weakness. The sensation is intact and there is no spinal deformity, scar, gibbous and tenderness present over the spine. The upper limb shows the wasting of the muscles with fasciculations in the hands and arm. The muscle power is diminished, reflexes are exaggerated and sensation is intact in both upper limbs. The ocular movements are normal and there is no nystagmus in eyes. The patient has dysarthria with indistinct nasal speech. The tongue is vested with prominent fasciculations and palatal movements are sluggish with absence of the gag reflexes. The jaw jerk is also absent. I would like to check the gait of this patient, which may be spastic scissor-like, but the patient is unable to walk due to marked muscle weakness. The patient demonstrates the combination of the upper and lower motor neuron signs without sensory involvement, which is consistent with the diagnosis of motor neuron disease.